Have you ever wondered how your workplace could better support mental health? Today we'll explore some innovative approaches that are making a difference. In recent years, the importance of mental health in the workplace has become increasingly evident. Initiatives in places like Connecticut and Pennsylvania highlight new ways to support employees through difficult times. For instance, in Connecticut, construction workers who complete addiction treatment are paired with recovery coaches. Meanwhile, Geisinger hospitals in Pennsylvania have removed stigmatizing questions about mental health from their credentialing process. At the forefront of these changes is the National Institute for Occupational Safety and Health, or NIOSH. They're championing workplace mental health efforts, addressing high suicide rates among construction workers and burnout among healthcare professionals. However, this momentum faces challenges due to recent federal staffing cuts and budget reductions. Despite these setbacks, NIOSH's impact remains significant. Thomas Cunningham, a former senior behavioral scientist at NIOSH, emphasized how crucial workplace mental health interventions are. He noted that such efforts were gaining strong support before being disrupted. The agency's total worker health approach has been pivotal in redefining occupational safety to include mental well-being. Let's consider a real-life example from the local 478 union in Connecticut. Kyle Zimmer faced initial resistance from workers who feared being ostracized for seeking help. With NIOSH's backing, Zimmer implemented a members' assistance program. Over time, perceptions shifted as workers recognized that mental health is integral to safety on the job. Zimmer reflected on this cultural change, saying, "We have beat that stigma down by a lot." This transformation shows how sustained efforts can create safer environments where mental health is prioritized alongside physical safety. So why does this matter to you? About 60% of employees globally cite their job as a primary factor affecting their mental health. Workplace stress not only impacts individual well-being, but also contributes significantly to broader public health concerns, accounting for thousands of deaths annually and substantial healthcare costs. As companies strive to support their workforce better, there's a lesson here. Addressing mental health proactively can lead to healthier workplaces and communities. However, as Sally Spencer Thomas points out, recent cuts to NIOSH threaten these advances just as they were starting to gain traction. As we navigate these challenges, it's worth asking ourselves, how can we continue advocating for mental health support within our own workplaces? What role can each of us play in fostering environments that prioritize well-being? The answer may lie in continuing the conversation and pushing for policies that reflect a holistic view of worker health. Whether you're an employee or an employer, recognizing the value of these efforts is crucial for lasting change. Ultimately, ensuring robust support systems requires collective action and commitment, from government agencies like NIOSH to private industries and individuals alike. As we reflect on this shared responsibility, perhaps we can take steps towards more compassionate workplaces where everyone feels supported and valued. How will you contribute to this important conversation?